Obviously today I want to speak about the emergency care of exotic pets, and one of the reasons is because I think actually this is the point at which any practitioner, regardless of their experience with exotics, can make a significant difference. This is the point at which we can turn the tables and, you know, potentially improve things. And this is our aim. We don't want to hand back a dead animal. We want to go from the recumbent to the flying and avoid the dead parrot sketch if we at all can. So I wanted to just initially speak very briefly about what I'm going to include within this webinar and sort of the rationale for it. And I want to sort of encompass the whole of emergency medicine for exotics, really, if I can, even in a brief way, from having a look at sort of exotics within the hospital, which almost inevitably are going to be certainly a good proportion of your emergent cases. I want to also speak about the very obvious things that we need to apply to the exotics emergency. So the things that we've all been taught since veterinary school, so looking at our ABCs and how do we achieve finding the airway, controlling it, you know, making certain that the circulation is effective in various different animals. And then I want to have a bit of a discussion about shock, and inevitably that is one of the things that can really be a massive factor in both morbidity and mortality in these types of patients. So it's something that we need to recognise. We need to recognise the similarities and the differences in diagnosing shock in various species, and then we need to be able to consider how we would treat it. And I think sometimes it's very nice to kind of step back and go back to basics and consider specifically what we're doing when we're attempting this type of treatment. And then I think it's very important to know, if we're going to be treating shock, how to get into blood vessels and things like that. So skills and techniques that should be transferable but will need some tweaking within various different species. And then obviously, what are you going to have in your emergency kit, sort of equipment and sort of drugs and that type of thing. And then one thing that I do want to address that perhaps is a little bit looking further ahead surrounding the emergency case is the nutritional support of these animals. And I think it's very important to recognise that in very many cases that is going to be a necessity, compared with dogs and cats, where I think, you know, the majority of time we don't need to address this. I think in exotics it's a far more common issue. So I do think it's worthwhile considering that. And then things that we need to consider around, things that surround the treatment of these types of pets, particularly in emergency situations, which are the risks of treating them and things like health and safety and zoonoses. And then finally, considering potentially some common differential diagnoses, but in particular the role of nursing care plans within the emergency paradigm that we're going to have to set up. So what I would say to start with, and again many people will be very familiar with this concept, is that as animals that are not domesticated, a large amount of exotic pets will, in order to attempt to survive, hide signs of illness. So it becomes very much less predictable to owners, and certainly for us as veterinary surgeons, to kind of try and decipher at what stage the animal has in fact been presented. And I think from the vet's perspective, quite often animals are presented in what appears to be quite a bad way, but the history according to the owner, is relatively acute. And what I would say, one of the main cautions I would put at this stage, is that very often the acute or the seemingly acute phase of the disease process is in fact the animal failing to cope with whatever has been going on, potentially for a very long time. So it is certainly the absolute definition quite often of an acute on chronic presentation. And in terms of that kind of presentation, what we need to clearly recognize is that the functional reserves, by definition, are running out or have run out. And what that means is that when subjected to stress, these animals don't have very much left to play with. And what that leads me to say as my second point is that we have to be very, very careful with what we do with these animals in the hospital situation. And it is vitally important to recognize that many of these animals are not predators, they're prey species. And in order for them not to be immediately on high alert, we need to try and house them ideally separately, somewhere quiet, but certainly away from animals such as cats and dogs that they are going to perceive as predators. And predation and that type of perception to a prey animal is a significant stressor, and it can be the difference between a live animal and a dead animal. And we have to walk the line here between having an animal that's put away on its own in a darkened room, as is so often suggested, with an animal that is able to be sufficiently observed so that intervention can occur when it's appropriate. That's been observed by a nurse that something has changed and we need to go and do something different. So it's a difficult thing, but we do need to make certain that the hospital stay is as minimally stressful as we can make it. And as you know, a corollary of that is having some kind of suitable accommodation. And very often, certainly owners of smaller pets will bring the whole cage with them, and there's absolutely nothing wrong in keeping an animal in a very familiar environment, i.e. their own cage or their own vivarium, within the hospital setting, as long as you can observe the animal, as long as access is easy and safe, and as long as it's going to provide for their environmental needs suitably within that environment. So I'm not averse to having that happen whatsoever. And in terms of some pets, for example, things that require specific environmental factors such as reptiles, so the need for light, potentially UV light, and also increased ambient temperature and perhaps foci of basking spots, we need to be able to mimic that within the hospital environment in order to allow them to function well enough to heal and to repair whatever disease process is going on. And I think very, very early on, one of the things that I would say is that we need to be very clear about that and very honest as to whether that is something that's achievable, even for a short period. And if it isn't, then I think early referral, once the animal is sufficiently stable, has got to be considered. But most practice will have some form of heating, whether it's a heat mat or a heat lamp or something like that, that will do until something better can be sought. But we need to try and accommodate these species adequately. Equally, one of the most important things in terms of equipment that we need to do is to be able to weigh these animals accurately. And because we're dealing with a wide variety of sizes, the types of scales that we would use, you know, a cat scale may be very, very appropriate for something like a rabbit, but it may well not be appropriate for something like a finch or a mouse, where 1/10 of a gram change in weight